I'm Dr. Kevin Kavanagh, Board Chairman of HealthWatch USA, and I would like to welcome you to our 17th annual conference and webinar. This year's theme is the impact of long COVID on patients, workers, and our society. Long COVID is a term that describes the persistent and debilitating symptoms that far too many people experience after recovering from an acute COVID-19 infection. These symptoms can include fatigue, brain fog, shortness of breath, chest pain, and loss of smell or taste, along with other symptoms. Long COVID can affect anyone, regardless of age, gender, or severity of infection. It can have a significant impact on the quality of life of those who suffer from it. And even children can contract COVID-19 and develop long COVID. Although they are less likely to be hospitalized than adults, they still can become sick and they can spread SARS-CoV-2, the virus which causes COVID-19. Shown here are data from Sweden as of December 2020, which is the last data available. 75% of non-healthcare SARS-CoV-2 outbreaks originated in Sweden's elementary, grammar, and nursery schools. Far too little is known about long COVID in children. There is no consensus on prevalence. Studies vary widely with a prevalence range of 1.6% to 70%. As aptly summarized by Dr. Al-Ali, children are not likely to complain of brain fog or difficulty in concentrating. What is most likely to happen is that school performance will drop weeks and weeks later. The long-term central nervous system effects of COVID-19 can be profound and unfortunately are not uncommon, even in those who did not have a severe acute infection. CNS damage occurs in not only humans, but also in a wide variety of animals, even dogs. A recent study published in Emerging Infectious Diseases found damage in dogs' brains even with asymptomatic SARS-CoV-2 infections. In this study, no dogs exhibited apparent neurological signs or respiratory signs which resembled COVID-19, but still the dogs had pathological brain changes on autopsy. In addition, the dogs were able to infect other animals. Misinformation is a huge problem as it relates to COVID-19 and long COVID. Misinformation is fueled by mistrust and misunderstanding of science and research. Misinformation can also be highly organized and purposefully spread in the form of disinformation. Artificial intelligence will greatly augment the influence of misinformation, and AI has already impacted our society and unfortunately is already spreading disinformation. Some of the mistrust in science is being fueled by many of our leaders. For example, early in the pandemic, Boris Johnson referred to long COVID as bullocks and similar to the Gulf War syndrome. Unfortunately, this denial of long COVID and even the dangers of COVID-19 have persisted in our society today. And some of the mistrust in science is being fueled by federal agencies. Here is an agency recommending surgical masks to prevent the spread of airborne pathogens such as seasonal influenza and coronaviruses. This is utter nonsense. Surgical masks are not effective for this usage, and they are not designed to stop airborne pathogens. Finally, the disinformation can be highly organized. According to the Washington Post, leaked documents described hundreds of thousands of fake websites and bots operated by Russia's main scientific research computing center, and only approximately 1% of the bots and websites have been detected. And artificial intelligence or AI bots may well be turbocharging this disinformation. Generative AI can churn out misinformation which is even more persuasive than the false content created by humans, and it is extremely cheap and easy to generate this content. Strategically, AIs can change the output and conclusions of internet studies by modifying the input. For example, AI bots could flood VAERS, the FDA vaccine reporting database, with fake reports of adverse events, Entering false information and false adverse events into VAERS will fuel anti-vaccine movements and further divide our society. AIs can also spread disinformation by modifying video and audio files. You can obtain a video of a person and modify what he or she says, and it is very convincing. Shown in this slide is an example of a video which was made from a still picture and an audio file of a cloned voice. This is a deep fake video which was produced by uploading a picture of myself and an AI-generated audio file of my cloned voice. The software animated the picture and synced the lip movements in the video. This video was produced by a demo of an inexpensive, widely available software and illustrates the power of AI and its potential for social disinformation. Only 2 items were used to produce this video: a script and a still picture. You can also use the same capabilities to counter misinformation. The French Press Association is using AIs to screen content for misinformation on social media posts and other online content, including text, pictures, video, and audio files. Thus, a disinformation arms race has begun, with some AIs posting disinformation and other AIs attempting to clean up the damage. In addition, AI image generators can produce graphics for social media public service announcements, as shown by the one in the right-hand side of the slide. This picture shows 3 rotating AI-generated images, one of a girl in a red hood with a woof. Another picture is of a zombie who is hoping for just one more COVID infection to reach herd immunity, and the third of a Trojan horse. I then added the speech balloons and text. Each of these pictures are designed to counter disinformation regarding COVID-19. AI can also write and produce videos for the good. Here is another deepfake video where a generative AI, ChatGPT-4, even wrote the script. A prompt was given to describe the dangers of AI in medicine. The video is almost 100% AI generated, and it is made from an even younger still picture of myself. So here's the deepfake video. There are several challenges and dangers of utilizing AI in the healthcare sector. A recent report entitled Artificial Intelligence, Bias and Clinical Safety argues that in other industries, machine learning bots are often able to quickly correct themselves after making a mistake, with or without human intervention, with little to no harm done. However, there is no room for trial and error when it comes to patient health, well-being, and safety. At this point in time, healthcare AI can't weigh the pros and cons of a course of action or take a better safe than sorry approach as a human doctor might. In certain situations, a doctor may play it safe after carefully considering the safety and comfort of a patient, whereas a medical AI bot may go full throttle with an invasive strategy in order to produce the intended result. Now, this video is almost 100% AI generated. Only a prompt and a still picture was used for the input. Now, long COVID prevention is certainly key, and not contracting COVID-19 in the first place is key to the prevention of long COVID, and this includes the use of vaccinations and masking. Treatments for long COVID are still investigational, but advances are starting to be made. For example, in people with long COVID, serotonin is the only significant molecule that did not recover to pre-infection levels. This quote is from a New York Times article written by one of our webinar speakers, Pam Bellick. Because of the low serotonin levels, some people are even starting to advocate the use of Prozac as a possible treatment for long COVID. In addition, vaccines may also help to prevent and treat this disease. Now, before we start this webinar, I would like to thank our strategic partners who, without their help, this webinar would not have been possible. These include the Kentucky Rural Health Association, Southern Kentucky AHEC, the Massachusetts Nurses Association, and the Gardner Consulting Group. Now I need to give you some information regarding continuing education credits. If you are going to obtain ANCC nursing credits, you must attend the entire webinar. Other continuing education hours can be obtained commensurate with attendance. All relevant financial conflicts of interest for the speakers have been mitigated. You will be given links at the end of the webinar to submit a webinar evaluation and obtain your continuing education certificate. You must use the same email address you used to attend this event. Finally, I would like to ask that you submit all questions in the Q&A section. If there is time to answer them at the end of a presentation, we will. Otherwise, we'll answer them after the webinar and email them to all the participants. We will try to stay on schedule, but the actual starting times of the speakers may vary. Presentation resources and speaker slides can be downloaded from www.healthconference.org. Shown here is the webinar's agenda and speakers, which can be downloaded from healthconference.org. We will try to stay on schedule, but the presentation start and finishing times may vary. We hope this webinar will bring together researchers, clinicians, policymakers, and patients to share the latest evidence and best practices in the diagnosis, management, and prevention of long COVID. We also hope that this webinar will foster collaboration and innovation across disciplines and ultimately improve the outcomes of people living with long COVID.